The question today is, how do I treat tennis elbow? Very common question, very difficult question, very controversial question actually. For the last 20 odd years, it's been one of my great interests. I've boiled it down into three broad categories. The first is physiotherapy, hand therapy, splints. The second group is biological injections. And the third group is surgical procedures. So we go back to each group. The first group, hand therapy and splints. If you go and see someone who's trained as a hand therapist, they'll know the anatomy very well. A counterforce brace is a strap that goes around the proximal forearm here, and you've probably seen those. They act a bit like the capo on the neck of a guitar, which when you pluck the entire length of the string, the sound resonates. When you pluck the string with some of it clamped off by the capo, only the remaining portion resonates. And in a similar way, when we clamp or strap our forearm, we're shielding the force at this end of the elbow, and we're actually dissipating the force when we move our wrist extensors and our finger extensors, and not all of the load is seen at the lateral epicondyle of the elbow. So that's how that device, I believe, has an effect and works. Secondly, a wrist extension splint, which is a brace that goes across your wrist. They stop one of the four common extensor origin tendons from moving, and by keeping it relatively still, we're lessening the force seen at the tear site, which means less tennis elbow symptoms. So in other words, these two splint devices helps to minimize the forces seen by a torn tendon and allow that tendon to have a rest and allow that tendon to heal. I hope that makes sense.